What is the most appropriate action? So the most appropriate action for obtaining informed consent for the emergency craniotomy. So it's an emergent craniotomy procedure required for a client brought to the emergency department by EMS after a car accident who has a severe head injury, multiple fractures, and is unconscious with an unknown name. So you got nothing. You just know that they need an emergency craniotomy and you need informed consent. Let's see. What do we do? Proceeding with the surgery without consent. I mean, it's an emergency. The patient needs it. Let's move on to the next one. Obtaining a court order for the procedure. It's emergent. If you get the court order, he might die. Can't wait. Seeking consent for the EMS team. From the EMS team. They don't know this guy. How are you going to ask her? It's like asking for a consent from the guy at the gas station. You don't know that. Doesn't work. Contacting the police to identify the client and find their family. Yeah, and wait for the patient to die? No. The only one that makes sense is proceeding with the surgery without consent. Whenever a patient doesn't have informed consent and it's an emergent, you always just treat the patient, especially in an emergent. So emergency and you need informed consent. You need the informed consent. You just do it. Nike. Just do it. Assume consent. I know I said don't assume. This is one of the few cases you do assume. All right? Nike. Which statement would the nurse record in the occurrence report after responding to a client who was found lying on the floor after calling for help? So it's like training day. It's not what you know, it's what you can prove. The client climbed over the side rails. Can you prove that? No. Did you see that? You didn't see that. The client fell out of the bed. You don't know that. Did somebody push the client out of the bed? You have no idea. It's not what you know, it's what you can prove. You probably have a pretty good idea, but it's not what you know, it's what you can prove. The client was found lying on the floor. Sounds pretty good. Doesn't come with any assumptions. The client became restless and attempted to leave the bed. You don't know these things. These are all assumptions. Remember, no assumptions in medicine. No assumptions. Why? Because that. So, the client was found lying on the floor. It's like training day. It's not what you know, it's what you can prove, Jake. After a client has fallen, the nurse and the primary health provider have determined that the client is not injured. After completing an occurrence report, what will the nurse implement next? So what's next? Hold a meeting with the staff to discuss the fall. So a patient falls, you hold a meeting? No, that's not the next step. There's millions of patients to be taken care of. That's not the next step. Recheck the client's condition. It's your patient. Recheck the patient. That's why you're in the field. Recheck the client's condition. Absolutely. Let's just see the other ones for fun. Update the nursing supervisor on the fall. That's not a bad idea, but it didn't ask you what's the next step to perform if the nursing supervisor asks you a question. It's the next step right after the patient has fallen, you determine is not injured. You have to reassess your patient. Next, record in the nurse's notes that the occurrence report has been filed. No, check your patient. That's why we're in this field. Check your patient. The night shift nurse walks into the medication room and discovers a colleague with a tourniquet around their upper arm and a needle connected to a syringe filled with a clear liquid about to be inserted into their antecubital fossa. Holy crap. Somebody's doing something naughty. What is the best course of action for the nurse? Notify the nursing supervisor. It's probably a pretty good idea. Let's see what else. Contact security. Yeah. Then, first of all, they're not doing anything to harm others. So at this time, I don't think it's the best idea to contact security. Nobody else is in danger. Contact the police. Nobody is in danger at this time. You don't contact the police for this. You're in the hospital setting. Confine the coworker in the medication room until assistance is obtained. Yeah, this nurse might be a drug addict. They might take you down if you try to confine them. Don't do that. Don't become a Superman or Superwoman. Notify the nursing supervisor. Get some help that way. They would know how to deal with this, okay? What is the most appropriate response the nurse would make to the client who asks for assistance in obtaining a witness for an instructional directive? So that's like an advanced directive. So if a client asks you for assistance in obtaining a witness, what do you say? I will not be able to sign as a witness to your signature. That's not, you don't say that. First, if you don't know the policy, you don't say that. You have to first find out the policies in your hospitals and your location and your state. I will contact the nursing supervisor for guidance on your request. Yeah, if you have no idea, that's probably a pretty good idea. Let's see what else we have. You'll have to find someone else to witness the document. You don't know that. Maybe you are able to be a witness. If you don't know, you gotta get help. It's not within my role to find a witness for you. Remember, help the patient. Jeez. Yeah, cutthroat nursing, yo. So yeah, I will contact the nursing supervisor for guidance on your request. Yeah, try to help. Try to help. Maybe you end up not doing it because you know you're not allowed to the hospital. But first, find out what would be the best action for a nurse who is told to report to the ICU. So you've been told go to the ICU, which they have never worked in before. So you're new to this due to understaffing. Yep, this has been happening and needs additional support in caring for clients. So you got the lucky number. Refuse to work in the ICU due to lack of unit orientation. No, they're allowed to float. Unless you have a contract that says no, you assume that you're always allowed to float. Seek clarification of the hospital policy on floating with the nursing supervisor. It's not the next step. If they've asked you to float, typically they already know that they're allowed to. They're going to cover themselves too. Confirm the ICU client assignment with the team leader to guarantee it is a secure assignment. Yes, double check if that is exactly what's happening. Are they really sending you to the ICU? What's going on? Okay. Write a formal complaint. Yeah. Oh gosh. Write a formal complaint to nursing administration and then contact the hospital's legal representative. Wow. That escalated quickly. No, not yet. First, confirm the ICU client assignment with the team leader to guarantee it is a secure assignment. Everything else is jumping the gun, really. They are allowed to float. COVID times, yo. Which steps should the nurse take to correct the mistake? So there's a mistake of an accidental medication waste of an opioid pain medication in the client's medical record. So you accidentally wasted some of the medication, you didn't give everything, and you documented. So simplify it. You were supposed to give, let's say, 5 milligrams, but you accidentally gave 4 milligrams and you wasted 1 milligram. But you documented that you gave the 5, but you actually only gave 4 because 1 was wasted. You get that? So update the medication administration record to reflect the accurate information. Absolutely. Update. Make sure you reflect that you actually only gave the 4 in this case instead of the 5. File an occurrence report. No, not yet. The patient hasn't been harmed. You gave a lower dose. You can fix it. Just make sure you update the record and give the patient exactly what he needs. Document the correction with the nurse's signature and title. Yes, put your title on there and your signature to document that you made a mistake. Get a co-signature from the witness to the medication waste. So if you had another nurse present there with the medication waste, make sure you have that documented. It's always good to have a witness. Note the corrected information in the client's nursing notes. Absolutely. All this stuff is just basically cover yourself. Make sure you write the truth, okay? All this stuff is good. Write the truth. Be honest. We all make mistakes, okay? You're going to have many of them. I have had many of them. Just own up to them. What indicates accurate nursing documentation by the nurse? Choose all that apply. The client seems to be stressed at the time of respiratory treatments. Is that something that's accurate? Client seems to be stressed? No. Maybe he's not stressed. Maybe you think he's stressed, but he's not. The client slept throughout the night. Yeah, if the client slept throughout the night, you can't argue that. That's pretty accurate. The client displayed anger when roused for vital sign monitoring. Maybe you just woke him up. Maybe you would do the same thing. Emotions. Sometimes you misread them. The abdominal wound dressing is dry, in good condition, and without any drainage. Yeah, that's a physical exam finding. It's good. So far, I like this one. I like this one. The left lower leg wound on the medial side is 3 centimeters long without any redness or discharge or swelling. Yeah. These are all just facts, okay? These aren't emotions. Facts greater than emotions. Okay? Good. What situation represents a violation of a client's right to privacy according to the lecture on clients' rights given to the nursing student by the instructor? So you were given a lecture on a client's right to privacy. What's a violation? Carrying out a procedure without the client's consent. That's not really a right to privacy. It's more like battery, where you touch a patient without their permission. Issuing a threat to administer a medication to the client. Is that where we're getting to, where we threaten patients? That's assault. It's when you threaten a patient harm and cause them to be afraid. You haven't touched them, but you've threatened them. That's assault. The other one, you've touched them. Prohibiting the client from leaving the hospital. That's false imprisonment. False imprisonment. It's like keeping a hostage. We don't do that. None of these. Observing the client's care without their permission. Yeah, that's a invasion of their privacy. That's definitely an invasion of privacy. You're not giving them any privacy. You are witnessing their care without their permission. That's not privacy. Everything else is basically you have battery, assault, false imprisonment. This is a criminal nurse here. What action should the nurse take first after receiving an unexpected sexually explicit photograph via the fax machine instead of a laboratory? Oh, that escalated. Sexually explicit photograph via the fax machine instead of a lab report. So the lab faxed over some nasty pictures. Do you report the incident to nursing supervisor? Yeah, you got to snitch, man. Dispose of the photograph? What? And then don't snitch? No, you got to snitch. What are they doing down there in the lab? Contact the laboratory to find out who sent the photograph. Yeah, they're going to tell you. No, you got to snitch on them. Report the incident to police. That's escalating it kind of fast. You don't need to get the police involved yet. First, get the nursing supervisor on this. Find out what's going on in the lab. Why was that sent? What are they doing down in that lab with all those petri dishes? The nurse is seeking clarification on a new medication prescription with a higher than recommended dose and is unable to reach the primary healthcare provider. Which action will the nurse take? So, the dose is higher than what is recommended. What do? Do you just give the medication as written? Heck no. You need to clarify this. Is this what they really want? And then if they do want it, you document that that's what they want. But until then, don't give it. Consult the nursing supervisor. It's a pretty good idea. Find out what you can do in this case if you can't reach the primary healthcare provider. Delay administering the medication until the PHCP can be reached. So you're just going to sit there and wait and twiddle your thumbs? No, you got to do something. That's why I like this one so far. Provide the medication at the recommended dose until the PHCP can be located. No, so you're providing it at a lower dose. The PHCP wants it at a higher dose. Find out why and then do it. But until then, if you can't reach them, you need to consult the nursing supervisor. Get help. Help. Don't be afraid to ask for help, okay? Don't be afraid to ask for help. We all are going to need it sometime. An older client is brought to the emergency department for treatment of a fractured arm. During the physical assessment, the nurse notices bruises, both old and new. So this is things that have happened in the past and things that have just recently happened. On the client's chest and legs. When the nurse inquires about the bruises, the client confides that they are a result of being physically struck by a family member when they do not have dinner ready when the family member returns home from work. Dang. In response, what would be the most appropriate action for the nurse to take? Discuss the situation with the family member. Why? So they can go get beat later? Come on. Common sense. Don't do that. Report the abuse and provide support while finding a safe place for the client. Yes, our job is to take care of the patient. Safe place, I like those words, and report the abuse. Provide support. Yes. Let's see what else is there. Offer advice on managing time to avoid future incidents. So you're going to offer advice on how to avoid that? What? Get the dinner ready, manage your time better? Come on. They're just going to get beat up on something else. Suggest seeking help from friends. No. They're seeking help from you right now. You need to help them. Report the abuse. Support. Safe place. That's why we're here. That's why we do what we do. Take care of patients.